Aortic aneurysm is a localized enlargement of the aorta. Aorta is the largest blood vessel which carries oxygenated blood to the body. The aneurysm can increase in size as time progresses and can even rupture occasionally with catastrophic results. Operations and other procedures done when the aneurysm is enlarging rapidly can prevent this catastrophe. Risk factors for development of an aortic aneurysm is similar to those for a heart attack, though both are entirely different conditions. Heart attacks are due to blocks in blood vessels of the heart. High blood pressure increases the chance for development of aortic aneurysm. It is also a risk factor for heart attack. Male gender is another risk factor, with aortic aneurysms being commoner in males than females. Advancing age is another risk factor, more so after the age of 65 years. In fact, several countries have implemented mandatory periodic screening for aneurysm of the aorta in the tummy, abdominal aortic aneurysm AAA, with ultrasound examination. Please view the full version of this video at my Cardiology Talks channel and subscribe for updates. Useful for early career medicos and paramedics. Link given below this video.